Millions of people with chronic symptoms, especially chronic pain, are being misdiagnosed and thus mistreated by their doctors. In my GotPainCure series, I talk about tension myoneural syndrome, the too much stress diagnosis that totally makes sense. And perhaps you're wondering, if it totally makes sense, then why haven't I heard about TMS before? Or more importantly, why hasn't my doctor told me about TMS before? Allow me to address your skepticism. In the 1970s, Dr. John E. Sarno theorized that the cause of chronic pain in many of his patients was linked to stress and emotions. This required a new treatment approach entirely unlike the usual methods of drug, surgery, and physical therapy. He called this form of pain tension myoneural syndrome, or TMS. Myo refers to muscles and neural to nerves. He found that TMS was associated with painful emotions that were usually repressed. Dr. Sarno treated his TMS patients with education. In a group workshop, patients learned their chronic pain was not caused by an organ disease or structural abnormality, like a herniated disc, which came as a shock to everyone. He went on to explain how repressed emotions, especially rage, but also fear, shame, guilt, or grief, were the source of their pain. Patients also learned that perfectionists and those who always try to please and care for others are more prone to TMS. The information in his workshop was summarized into 12 affirmations he had patients repeat daily to keep TMS away. For those with childhood trauma or anyone who needed further guidance, Sarno referred them to a therapist familiar with the TMS approach. Even though Sarno's case studies showed high success rates and over 10,000 of his patients were cured of their chronic symptoms without drugs, surgery, or physical therapy, the medical community remains skeptical of adopting a new treatment approach. Want to know why? All truth passes through 3 stages. First, it is ridiculed. Second, it is violently opposed. Third, it is accepted as being self-evident. Theories such as heredity, germ-spreading disease, and football causing traumatic brain injuries were initially resisted by the medical community before being accepted as valid. Dr. Sarno's discovery of tension myoneural syndrome is no different. First of all, if TMS treatment becomes standard care, pharmaceutical corporations and the pain management industry would lose billions. Even though this would save money for consumers and insurance companies, plus reduce opioid overdoses, pharmaceutical corporations don't want you to stop buying their over-the-counter and prescription pain meds. So they spend billions on government lobbying, doctor incentives, and advertising to consumers. Basically, Dr. Sarno was the proverbial David in a battle with a big pharma Goliath. But in this case, pharmaceutical corporations don't have to lose, they just need to adapt to the demand for pain treatment that is more effective, affordable, and safe. Secondly, case studies aren't enough. Healthcare practitioners insist on reliable evidence for any new form of treatment before including it in their practice. Successful case studies, even when there are thousands of them, don't provide reliable evidence that the proposed treatment works significantly better than a placebo. But a randomized clinical trial does. RCTs of TMS are only just getting started, and this persuasive form of research can change the practice of medicine. The third reason why TMS was met with resistance is that when Dr. Sarno introduced his theory, the technology to objectively measure pain levels didn't exist. Even though 10,000 of his patients reported a decrease in pain, the subjective nature of this evidence didn't convince the medical community that was waiting for clinical evidence. Basically, charts and numbers mean more than what a patient says. Thanks to advancements in technology, we can now objectively measure pain levels in a patient through a functional magnetic resonance imaging test, or fMRI, of the brain, and see the altered nerve pathways that are involved when that pain is not explained by organ disease or structural damage. This supports a growing acceptance of the TMS approach. Studies over time show the link between stress, emotions, and pain, including 1. Herniated discs are linked to age, not pain. 2. Back surgeries are more successful in patients with no childhood trauma and far less successful in patients with severe childhood trauma. And 3. Whether the cause of pain is structural or stress-related, pain is perceived by the brain in the same way. Essentially, pain is pain. Findings such as these led to Dr. Sarno addressing a U.S. Senate committee hearing on Pain in America, exploring challenges to relief in 2012. A recent documentary, All the Rage, by Rumur Films, showcases Sarno's ideas and the personal experience of many patients suffering with pain linked to emotions. Dr. Howard Schubiner, author of the book Unlearn Your Pain, has recently completed the first RCT to document the effectiveness of the TMS approach for patients with fibromyalgia. The National Institutes of Health supported this RCT with a multi-million-dollar grant. For the 2% of my viewers out there who avidly read medical journals, publication is anticipated this year, so keep an eye out. In another RCT in Seattle, adding just one technique used by TMS clinicians, which was mindfulness stress reduction, led to improved long-term outcomes in a study of over 300 people with low back pain. Yay, science! Doctors who independently reached conclusions similar to Dr. Sarno came up with different names for TMS, including psychophysiologic disorder, mind-body syndrome, or stress illness. No matter what you call it, the condition is real, the treatment is effective, and soon enough, TMS will totally make sense to everyone. So to summarize, the epidemic of chronic pain and opioid deaths is causing a race to find a better form of treatment that has been under our noses for over 40 years. So, why hasn't your doctor told you about TMS yet? Within 5 to 10 years, they will. But why should you have to wait that long? For many, just learning about TMS and working to understand the stressors and emotions they have been ignoring can cure their symptoms. And you don't have to just take my word for it. I get it, I'm not a doctor. I'm just a woman who cured 20 chronic symptoms in a week that 20 doctors thought I'd have forever. No big deal. So let me point you in the direction of some amazing doctors. If you live in the US, visit the pbdassociation.org. And if you live in the UK, go to serpauk.com. Learn more, choose from a list of practitioners in your area, get diagnosed, and enjoy your life pain-free. Now you know. Share this video with everyone you care about and be sure to subscribe to my channel as I continue to add videos that walk you through how to cure your chronic pain.